Hi, Ayla Kessler here. I'm a board-certified medical oncologist, and my job on this channel is to give you all the information you need on your cancer journey. This is going to be the first video in our cancer treatment series, focusing on the broad classes of cancer-fighting drugs. I'm excited to share with you what I usually do for my patients starting chemotherapy for the first time. This is what we collectively call Chemo Teach or Chemo Class, and this is something you'd be scheduled for before you start your first cycle of that chemotherapy in the infusion center. To all of those who actually see this video before they get their first chemotherapy, I hope this becomes a strong resource for you to go to when you're preparing for chemotherapy. I'll also have other videos covering immunotherapy and targeted therapy, so make sure you check those out. Before we get started, I'd really appreciate it if you guys can hit that like button, subscribe, and hit that bell notification button also if you want to stay on top of the videos I drop every week. This is going to be the only way we can get this free information out there for patients like you. I appreciate it. Without further ado, let's get started. You get breast, colon, lung, esophageal, various kinds of lymphomas and leukemias. All these cancers have one thing in common, and that is chemotherapy as a proven option that extends survival and cure rates. You, as a result, may very likely be recommended this treatment option by your medical oncologist. Now, you may be wondering, is chemotherapy safe for me? Is it the right option for me? Do I absolutely have to get it? I mean, we've come such a long way in treating cancer in ways that nowadays, honestly, don't include chemo. However, I will caution you to not assume that treating cancer has to be somehow better off if it didn't involve chemo. Chemotherapy became the standard of care in so many cancers, specifically because of the decades worth of evidence-based data that prove that we're saving lives by using chemotherapy the way we do. If you think about it, other non-chemo treatments have been around for less than a decade, maybe longer. We simply don't have enough information yet or mature clinical trials that have run long enough for those non-chemo options to replace chemotherapy. There are so many success stories using the standard of care that it's truthfully not wise to skip chemotherapy just for the sake of skipping it or worrying about an inflated amount of danger associated with it without knowing all the facts first. Now, if you're still wondering if chemotherapy is the right option for you, I would highly recommend you bring all of your concerns and questions to your medical oncologist and have a candid conversation about the risks and benefits of the recommended course of action for you and your condition. Today, I'm not going to dive into the specific regimen names and doses used in each cancer, as those would be covered in the respective cancer series, so make sure you check those out. Number 2. Chemotherapy does affect normal cells just as well as it affects cancer cells. But the devil is in the detail here. You see, you need cells that actively divide and regenerate to pick up chemotherapy. Cancer cells are technically some of the fastest, if not the fastest growing cells in your body. So they'll take up chemotherapy the most. Next to cancer cells, you get your gut lining starting from your mouth to your rectum, as well as your blood cells that are housed in your bone marrow that are very rapidly dividing cells. And once they shed after they've been exposed to those few hours or days of chemotherapy, and the effect is not there anymore, the negative effect stops. Now your muscle cells and your brain cells, those only do it on demand sometimes, so they don't tend to get affected by chemotherapy as much. Number 3, chemotherapy is a toxin, but it will not kill you because it's a toxin. The doses we use have been studied to come up with the maximum killing effect for that cancer. That is also the maximum tolerated doses for humans. Most chemo drugs are dosed based on a person's height and weight, and sometimes even factoring in the kidney and liver clearance functions, among other factors. Number 4, each cancer has its own cocktail of chemo drugs called a regimen that are different beasts altogether, and because they're combined together tend to give you more likely side effects than other regimens. So a breast cancer patient, for example, can't compare how she'll do and what to expect from chemotherapy the same way as someone who's, say, received it for colon cancer. Number 5, not all chemo drugs caused alopecia, which is hair thinning or hair loss. Number 6, not all chemo drugs cause nausea. And those chemos that do, not everyone getting them will have nausea. Those images of people getting chemo, getting sick like dogs and throwing their guts out is really an unusual scenario in most cancers anymore. Number 7, not all chemo drugs kill your immune system. And if they do, that doesn't last too long. Number 8, most side effects from chemotherapy are short-lived, meaning once you're off of chemo, things will or should start to normalize. How soon? Well, again, that depends on the type of chemo and the person getting it. Notice I said most side effects go away because some of them sometimes linger on for a long while. For instance, fatigue can last months or years following the end of chemo, although it may get a lot better, but it may never go away completely for some patients, unfortunately. The same goes for chemo brain. That's a topic I'd love to just dedicate a whole video on soon. Peripheral neuropathy, that tingling and or numbness in your hands and or feet, may also last a short or a long period of time. Number 9, not all chemo drugs need a port to be administered. There are a few reasons to get a port, but we'll get through those in a minute. Number 10, and lastly, just because a side effect is common with a specific chemo regimen, doesn't mean you'll get it. Again, everybody's different, and you'll find that this is a recurrent theme throughout this video. Don't get me wrong, some cancers require pretty aggressive chemotherapy regimens that are associated with almost certainty with side effects, but that is definitely the lesser common scenario. And sometimes some outcomes can be easily avoided if your oncologist chooses to reduce, delay the dose, or stop chemotherapy altogether if you look like you're not taking it well. So, how do you get this chemotherapy? Most drugs are infused through a peripheral IV or a port. A few chemotherapy options may be available in a pill form. Now, some patients don't have a clue what that looks like or what that is for. A port, sometimes called a Metaport or a power port, among other names, is a central venous access device that is placed under your skin. The most common place for it is the chest on either side. And nothing sticks out of your skin when you're not accessed. But you'll still feel a button under the skin, and the back end of it is a tube that goes through your large veins that eventually pour into the heart. Why you feel it is exactly the reason it's placed is for your chemo nurse to feel and be able to insert her special Huber needle. And yes, it does have risks associated with it. Obviously, it's a foreign body sitting in your veins. Now, this port allows you to be able to have your labs drawn from there, to have IV fluids through there, to have the contrast infused in there for the most part to get your scans. And these ports are not used in every patient and are not necessary in every patient. We don't just use them willy-nilly in everybody. A port has to serve a purpose that makes its use and benefits bigger than the risks associated with it. So if you haven't been offered this and you're wondering why, just ask your medical oncologist, please. Now, chemotherapy is given in a cycle format. A cycle is a number of infusions associated with this chemo that are repeated every so often. So you get your chemo today and you wait, say, 3 weeks, and you come back and have the same thing all over again. That's your cycle. 3 weeks is your cycle. You may also have to come in between the 3 weeks once or twice to get a lower amount of chemo or the same amount of chemo. That still makes your cycle 3 weeks. But make sure you're on the same page when you're explained your cycle length and format by your medical oncologist. How long does the infusion last? It depends on the chemotherapy itself, how many chemotherapy agents you're getting that day, and the pre-medication mix you're getting prior to going in. Chemotherapy is not infused alone. You can't even infuse 2 chemotherapies in 2 different IVs at the same time. You have to imagine this process is pretty delicate and serious. It's not a simple infusion to go through and be in and out. You have to factor in way more than just how long each infusion lasts. I usually tell my patients to kindly bear with us and be patient on the day of chemotherapy and to just plan for the whole day being shot. Patients should expect no less than 2 hours of chair time only for the shortest, most well-tolerated, simplest regimens, to up to 6 to 7 hours of infusion time. When you get in on the day of chemo, you usually either get your labs, your pre-chemo labs, on the same day during that visit or a day or 2 before. You have to wait to see your doctor with the results of these labs. and you have to go through how you tolerated the last cycle, what sort of side effects you have, and working through those. And then you're cleared for chemo. Then and only then will pharmacy be notified that you're good to go so they can mix your chemotherapy. But usually you're waiting and you're getting your pre-medications while you're waiting for chemotherapy. Now, some pre-meds are 30 minutes long, some are an hour long, and it all depends on how many you're getting and how you're getting them. Some chemos go over 30 minutes of infusion time, and some take every bit of 3 hours to be infused. So you can imagine why it takes as long as it does. And every patient's regimen and situation are different. After the first cycle, we usually keep patients there for 15 to 30 minutes of observation time just to make sure they're okay to be released. What are pre-medications? These are either one or a concoction of 2, 3, or 4 medications given to prevent common or unique side effects expected from that particular regimen, such as nausea, vomiting, infusion reactions, or swelling and fluid retention that's caused by certain chemotherapy. Next, we're going to go over these side effects. Just remember, it's so important for you to maintain good communication with your cancer team and let them know how you're feeling at home during your cycle.